Hello, class. My groupmates and I are creating a hurricane adaptation and preparedness plan for Puerto Rican communities from our understanding of the impacts of past hurricanes like Hurricane Katrina on New Orleans and Hurricane Maria on Puerto Rico.
Hi, my name is Zoe Webster. I'm with Group 3 and we're discussing Hurricane Maria in Puerto Rico. Infrastructure was a major role in the destruction of Puerto Rico, with critical failures in the island's healthcare system were primarily responsible for the high number of deaths related to Hurricane Maria. The electricity grid was damaged immensely and took upwards of 200 days to restore power to all citizens. Many assets had already shown adverse impacts from aging even before the storms. Some considerations to take in for infrastructure is structural reinforcement, building climate-resilient buildings that are wind-resistant with reinforced concrete and strong roof structure. Waterproofing critical infrastructure such as the electricity grid is also of the utmost importance, considering elevation, flood barriers, and stormwater drainage as part of this. Emergency power and backups, particularly for facilities like hospitals. Following Maria, many hospitals had to rely on generators that were inadequate to power facilities, and some hospitals ran out of their fuel reserves for their generators, leaving them powerless. Thus, it is tremendously important that critical facilities have reliable on-site generators, extensive fuel reserves, and battery storage. Site planning and landscaping with disaster proofing in mind is also important, creating permeable surfaces, retention ponds, avoiding wind tunnel effect. It is also additionally important when considering the built environment to protect and support ecosystems and natural buffers to mitigate extreme weather hazards that may threaten your buildings and campuses. Green infrastructure practices, such as heat island mitigation and enhanced stormwater management, are key contributory strategies. Frequent maintenance and inspection of infrastructure, including regular structural assessments to make sure that things are in accordance with disaster proofing. With this in mind, challenges can arise from the initial economic investment required to properly build and maintain hurricane-proof infrastructure, even though in the long run it will prove to have economic benefits.
Hello, welcome. I'm Tracy Ford. Today I'm sharing a preparedness plan to strengthen buildings in Puerto Rico against hurricanes and other climate threats. Puerto Rico faces extreme weather like strong hurricanes, flooding, and heat. These changes demand action, especially in housing. Our goals include safer homes, better building practices, and protect vulnerable communities across the island. First, we must update and enforce building codes using models like Florida. Provide proper training and inspections are key. Hurricane Maria showed us the cost of weak infrastructure. We can't afford inaction. But Puerto Rico's adaptation is tough when federal disaster aid is delayed or restrictions due to Puerto Rico's unique political status. We need to make sure there's consistent implementation across municipalities and provide ongoing training that progress stalls. Comparing Puerto Rico to Miami, we notice there are gaps, fewer wind load protections, weaker flood mitigations, and less enforcement capacities. Miami's model should inspire, not intimidate, and we can tailor it to Puerto Rico's realities. We must prioritize vulnerable populations and implement a home retrofitting program. Over the next couple of slides, we need to explore future building ideas, innovating materials such as smart adaptive building skins. Future ideas such as bio-inspired nature-designed buildings. We should explore all the different technologies and resilience, from self-heating components to ultralight materials. And let's use drones as soon as after a disaster occurs and survey the area and the damage. There needs to be financial incentives like grants and loans that can support retrofits and new construction. By empowering local labor, designing affordable, resilient housing, and educating residents, we can foster bottom-up resilience. Building knowledge is just as crucial as building walls. We need to provide opportunities to innovate with community-led upgrades, community workshops on upgrades and retrofitting. With a clear timeline and strong partnerships, we can build safer communities that brings together people, science, and equity. The effort requires coordination of local, federal agencies, nonprofit, engineers, and most importantly, the Puerto Rican community themselves. We measure progress by how many homes are reinforced, how many families benefit from funding, and how well our communities understand and engage these efforts. To close, Puerto Rico's path to resilience is not just about buildings. It's about justice, autonomy, and preparation. As a territory, the island must fight harder for support. But with a unified strategy, we can ensure safer and stronger homes for every Puerto Rican family. Thank you.
My name is Belu Carpenter, and this is the Emergency Evacuation Plan for Puerto Rico. The highest population density on the island is in the greater San Juan area with over 330,000 residents. The first phase of evacuation is mobilization. This includes notifications of the event by cell phone messaging, email, radio, television, and door-to-door. Puerto Rico is a high tourist destination, so notifications should be available across languages. Incident command will start operations, shelters will prepare, assessment of evacuation routes will be reported, preparation and evacuation will begin for vulnerable communities. Vulnerable communities include the elderly, hospitals, and those with medical needs, those without transport, unaccompanied minors, and prisons. The main evacuation. Evacuations will be done by zone, the highest risk zones leaving first. Because highways in Puerto Rico do not have a consistent shoulder, shoulders should not be used as an extra lane. Those sheltering in place should finish securing whatever resources they need. As a last resort, if highways become gridlocked as hurricane landfall approaches, we will contraflow traffic, making all lanes available exit only. During the impact phase, all public facilities will be closed and first responders will seek shelter. The mass care phase. During this time, we will focus on care related to public health, mental health, emergency assistance, and fatality management. Continued work on future evacuation operations will include widening the highway shoulders to make an extra lane when needed, reinforcing bridges for secondary route options, reinforcing fuel options for evacuation routes, and paving secondary roads leading out of flood and storm surge areas to be available for evacuations. My name is Belu Carpenter, and this is the plan to adapt to risk for Puerto Rico. The best thing you can do for yourself and others is to be prepared. It's important to know your evacuation zone. Know your evacuation route and practice it ahead of time. Have a backup route. Don't take back roads and avoid bridges. Be ready to evacuate when asked. Do not wait until the last minute. Have a go bag ready. This should include items such as your medications, food and water, important documents and ID, flashlight and extra batteries, and a list of important phone numbers. Make sure those in your social network have a plan. Know where your friends and family will evacuate to, and if going to a shelter, know ahead of time what resources will be available there. As hurricanes continue to increase in number and strength, it is important to continue developments in risk management. This means continuing to improve storm surge models, invest in disaster education, develop more robust communication lines, keeping people connected throughout the disaster timeline, and investing in nature-based solutions to enhance flood resilience.
Hello, my name is Liana Antonio Arevalo. I will be covering the measures for the public's physical and mental health in Puerto Rico during and after a hurricane. Problems within Puerto Rico started even before the hurricane. There were high numbers of chronic disease, poverty, unsafe water, and air quality in Puerto Rico versus in the United States of America. After the hurricane, access to unsafe water, food, and sanitation increased. There was infrastructure damage to communications, electricity, and transportation. Lack of resource and stable infrastructure forced hospitals and clinics to shut down or limit patient intake, and the increase of mental health issues was abundant, with many residents visiting hospitals for psychological screenings. Government solutions to be better prepared for destructive storms starts by increasing the resilience of hospitals, creating better access to the electrical systems and energy generators, and overall creation of more clinics and hospitals, as well as opening more access to the government's health benefits for Puerto Rico citizens. Government aid responses like FEMA need to be more just and focused on the rehabilitation of all under the USA government. Lastly, increasing the access to safe, clean water all throughout the Puerto Rico by adding water treatment and pumping facilities, as well as closing unpermitted and unregulated dump sites. To create better mental health, the public needs to be more involved with the understanding of what they can do to reduce the damage of physical and mental effects of large storms. They need to create an evacuation or shelter plan and watch weather reports on the storm's route, keep good relationships with family and friends for financial and emotional support after a storm, create a connection and understanding with the environment, as well as keeping your body and mind healthy to be able to control the situation when the storm hits. In conclusion, we can We have gone over what it needs to happen to improve mental health by being prepared for a storm, the necessity of government action towards equal access of aid and health benefits for all territories, and making sure to create a plan either for evacuation, shelter in place, or managed retreat from homes and facilities closest to the storm's reach. Lastly, and most important, it is to create more resilient land use development, starting with better access to safe, clean, and healthy water, food, and health benefits, and creating more resilient infrastructure for hospitals, buildings, and homes. Thank you for watching our presentation.